Hey there, my name's Dr. Dawn Heiman, and I'd like to talk about sprucing up your office and improving your patient-centered system. So the best way to ensure that people want to come back and want to refer others is to give them a great experience. And as you know, I worked at Walt Disney World as a college student, and we were taught that anyone who comes into our business is our guest. And we are cast members, meaning that it is our role to ensure that they have a great experience. So I want you to walk into your office tomorrow, this morning, later on, and come in from the perspective of a new patient. Really look around, and what's the feel when you walk in? There are some stores and some businesses, some restaurants, even people's homes that we walk into and we think, oh, I love it here. Hotels do this. Little shops that have certain scents and cute little pillows and things like that that really make us want to buy up everything. Or even Starbucks sometimes. You know, you walk in and you're like, oh, I feel so special. I can't believe I'm here. Is there a way that we can look at our offices and say, yes, that scratch has been there for 10 years. We need to paint. Or, oh, it is a little dull in here, isn't it? Or what's the vibe when they walk in? Does someone greet them and say, good morning, I'm so glad you came. Was it okay? Did you find the office all right? How are the directions? Do you want a cup of coffee? Are they happy to see them? Are they inviting them to have a seat, even if it's very busy? Are they engaging with them and saying, I'll be with you in a moment? Or when they walk in, is someone not even talking to them? Have a seat, we'll be with you in a moment. How about when someone's answering the telephone? Advanced Audiology Consultants, how may I help you? Oh, wonderful. Yes, I can help you with that. Do you mind holding for a moment while I finish up helping this other patient? Thank you. I'll be right with you. And putting them on hold as opposed to Advanced Audiology Consultants. Please hold. Has that ever happened to you? You call the place, you're so excited to get through, and they put you on hold right away. And they didn't even give you a moment to say yes or no. They just put you on hold. The best way to encourage the free word-of-mouth marketing that we all need and want is simply by treating people well. We need to look at our spaces. We need to look at, are the chairs comfortable? Are they sturdy? Are they clean? Is there a stain on one that everyone's avoiding? Should we have that cleaned? Can we replace these chairs? How about the smell? Personally, I can get a migraine from certain smells. So it's not like you want over-the-top cologne smell and things like that, but you at least want the place clean and fresh. It doesn't smell musty and dusty, does it? When you go into the room with the booth, do you start sneezing? What amount of dust is on bookshelves? Are the books decaying? Do they smell old and musty? When was the last time the carpeting was changed? You know, a lot of people are in leases and it's very awkward and difficult to move. So you stay in the same place. But generally when you re-sign a lease after 5 years, 2 years, 10 years, generally with that lease, they're supposed to replace the carpeting and maybe even paint the walls. And if you give them an opportunity, they could, because you're paying for it. Once you move out, you never get that money back. And you want to make sure that your office is refreshed. So when the patient comes in, are you treating every patient the same way? Do they feel like as they've been assessed and treated, even as they're leaving, that this has been a great experience? Are you smiling and waving and saying goodbye and you can't wait to see them next time? Or are you saying, okay, check out with so-and-so, and then going back in the other room and closing the door? And is so-and-so making certain that they're happy as they leave? We have candy. We're making certain that they know when the next appointment is. We're trying to make their life as easy as possible because we know that going to doctor's appointments is not fun. But could we add a little fun? Can we add a little quirkiness? Can we add a little sugar? Even my diabetic patients. I have a child with diabetes, and I know you can write down exactly the amount of carbs that are in a piece of candy. And they're like, oh, I have diabetes, but I'll just take one. Great. Here, did you know? And you pull out the package or you have it written down. That has 5 grams. Just so you know, it's 5 grams. It's not like they're taking the whole bag home and consuming the whole thing. But if they know what the carb level is, then they can adjust for their insulin. What's the parking like at your office? How far is the walk? Could you bring out a wheelchair for them if you know it's going to be extra far? Could you ask them, please call us from the car and we'll come get you? I unfortunately know of a lot of patients who have passed away over the years, and I know that they had wheelchairs. And you could always reach out to just your community in general and asking, does anyone have a wheelchair in their basement that no one's using? We could really use it. It would be great for our office. One way to get ideas about how to refresh your office is to just look around at other offices, other businesses that you love. How about ask some of your colleagues around the country to show you pictures of their office? Can you copy what they've done? Can you tweak it to make it your own? So ask yourself, how can we make things better in our office, even if it is really good? Think back, why do people come to you? Why did they used to come to you? Have you forgotten about why people originally came to you? Why did they fall in love with you? Revisit what it was you used to do, or innovate and add on more things. Because the bottom line is people want to purchase things and services from other people. They really don't want to just buy something online and not be helped in any way. And if we're not creating a great patient experience, we could possibly lose those patients. So I hope you're having a great day, and I will see you soon. Bye-bye.